Dr. Mary Barnhart, thank you for stopping by.
Thank you, Les. Always a pleasure.
I want to talk a little bit about the perception of mammograms, because I think a lot of women are under the perception that mammograms are what they used to be 10, 15 years ago, but technology has changed, hasn't it?
Very much so.
So talk about that.
And I, sadly enough, can relate this to my own mom, who wouldn't get a mammogram until she was 60 years old because she read in Ann Lander's column, the little column that they heard. And so I had to convince my very own mother that they don't. So it's not something that just nobody thinks about. And when you say mammogram, ladies' minds go, oh, this is going to really be painful. And so there can certainly be the emphasis, well, you know, I need to do this, you know, I'm tough, I can go in and endure this. But the nice thing is, in addition to the technology being much better in terms of the quality, we now take digital mammograms. Patients can see right away what the picture of their breast looks like. And so if you can couple that increase in great technology with something that's more comfortable, then women say, hey, I can go and do that. It's not the frightening experience it used to be, plus the improved technology, we can get a great picture. For instance, I'm very privileged to work in a medical plaza at Gresham Imaging, where they have what's called soft pad. And so there's a soft, warm pad that really makes the compression much gentler for the patient. So while they're having a more comfortable experience, they can rest in the knowledge that knowing this is great technology, so we can see what's going on.
And how reliable are the results?
Very nice. And so if you couple that with good breast self-examination, good clinical breast examination, sometimes with the supplement of an ultrasound, great technician in terms of how the mammographic picture's actually taken, you can get in the range of close to 95% that we're going to be able to really see from an imaging standpoint what's going on. Not 100%, but no imaging tool that we have is at 100%.
So without doubt, mammograms are definitely something that people should always consider. How often?
Good question. In a person who is what we would consider average risk, possibly no family history, just young, healthy woman, doing a baseline between the age of 35 and 40, and then once she gets that magic age of 40, then doing them every year. Now that's with the understanding that things are going along and they're fine. Should she have an abnormality that would necessitate maybe further study with ultrasound, we have breast MRI today. There are even technologies that we're starting to use called PEM mammograms, and that stands for the well, all of us know what the PET scan is, where it's a whole body cancer scan, and so they've combined that technology with a mammogram, and so that's even something that's helpful. But that's more in the future.
It's really amazing what's happened with technology.
It's incredible.
I mean, that's hopeful for the future.
Yes, yes. And so we have today a very good standard. So if you're able to get a comfortable soft pad mammogram, digital technology, good technical skills with that, and you're doing it at the right sequences, coupling it with things you can do, it's a huge, huge help to patients and definitely for those of us wanting to help them. And it's one of those things that if patients get used to the fact that this is comfortable, I'm doing something for myself and for my family, it's a great advantage.
Great. Dr. Mary Barnhart, thank you very much.
Thank you, Les.